Welcome to the EMT Pro podcast, where we deliver relevant EMS content from the field in the classroom each week. Each episode of this podcast can get you 1 full hour of CE through our partner emt-ce.com, so head over there for more information. We are bringing you guys a special remote podcast today. I'm your host, Steve Williams, and with me remotely is Dan and Holly. Guys, say hi.
Hi, Steve. Hi, Holly.
Hey, guys. How's it going?
Surviving. How are you guys doing?
It's a little odd. It's just odd doing it this way. Usually I'm looking at Steve's bald head and Holly's shiny teeth, and this is what I get in my bedroom.
Yeah. It's a little bit of a bummer, I'm not going to lie. But the good news is, so far at least, our audio tests look like everything's coming in clearly. So that's good. But yeah, definitely miss your guys' smiling faces and laughter in the room. And
all the edits that we have to do.
All the edits. So many edits. Oh, my goodness.
Oh, yes.
Well, kind of in line with just this year in general, wasn't planning on doing this podcast, but would like to do today's episode on basically how COVID is affecting you personally and professionally. And I think between the three of us, we've got some interesting stories, and wanted to do kind of a check-in on just a couple of the hot topic COVID items with vaccines and everything else coming out, and kind of go from there.
Sounds good.
All right.
Yeah, sounds great.
Cool. Well, I guess, Dan, I want to start with you in terms of how COVID's affecting you professionally, and talk about kind of what's going on at your department, what you've been seeing call-wise, and then also just chat with you about what your guys' plans are for vaccine rollout, and if you've been given any info, and just kind of see where you're at.
Well, I tell you, it seems like this is a never-ending year. I don't even remember when this started. I know that there was so much more anxiety, back in the spring, with the PPE or lack of PPE, the whole, am I going to catch COVID on this call? And now it's literally every other call is COVID call. And, I was never a PPE guy, being in this 30 years, I rarely wore gloves. Now there's nothing on my body that's not covered. Mm-hmm. And, so that's a good change. What's not good is I feel my level of care has gone down.
Yeah, I feel that too.
I feel my compassion has gone down.
Mm-hmm.
I just want to get
your tolerance for these calls?
Oh, no, just compassion for in general. It's like,
okay,
why are you, if it's like a non-critical call, like, why are you calling me? Do you have any idea what's going on out there right now?
Yep.
Yeah.
You do not need to go to the hospital. There's no reason for me to be here being exposed.
Correct.
And so my tolerance level has gone down, and it's not fair to the patient, because I signed up for this job to deliver great patient care and to be compassionate, and I'm not doing that. I mean, two days ago, I had a call in a COVID hub, place where they ship all COVID people from some of the nursing homes. Mm-hmm. And so it's horrible.
Yeah. And
I'm in full PPE, respirator, the whole thing. I can't even talk. And the ambulance got there first. And it's one of those mediocre medics.
Yep.
And this guy's unconscious. He's 80-some years old. His stats are in the 70s. He's aspirated. He's low blood pressure. And because I couldn't have a conversation with the medic saying this guy needs to be intubated, and I started thinking, if I really want to intubate this guy, but then I've intubated several COVID people. So, I just feel like, had this been a year ago, much more aggressive.
Right.
Now it's like, well, I've already tubed someone today. I don't need to do it again. So
right.
I don't know. I really miss sitting down and having a great conversation with, the patients and the older people and hearing their story. Now it's just, okay, get on the car, let's go.
Yeah.
And I don't like that. And I see that throughout our whole department.
Do you feel like it's because you're trying to have the least amount of contact with people as possible?
Least amount of contact. I got to move to the next call because it's coming down the road. And I'm tired. I'm tired of seeing the death. I'm tired of seeing the sickness. Mm-hmm. I'm tired of at the fight company, transporting people in their 20s who are probably not going to make it, who are, on ECMO, and then you have the people say, oh, this isn't a real disease, and so on and so forth. I'm just losing my patience all around.
Yeah. I really try hard not to get political in, life, unless it's my wife and I talking at home by ourselves.
Right.
But I had one outburst at work the other day, and it still kind of eats me up, but it just felt like it was so infuriating. But
and this is en route to the call?
No. Yeah. So this actually happened when we got back from a COVID-related cardiac arrest. It just kind of came out, and I'm still mad at myself for saying it, but I repeated Trump's line of, it's just going to wash over, the entire country, like a miracle, it'll be gone one day kind of a thing, And I was so ticked that, any leader in our country would be that ignorant to say something like that. And, I have respect for the right side of the aisle, the left side of the aisle, the middle. I don't think any of them are, better than the other at all. I think they both have their pros and cons. And not getting political on this podcast, but I was just so disappointed to hear that. And then that was the first thing that came to the tip of my brain when I'm coming back in, having to do this decon, and, now we've got to literally wipe down everything. And, then we get to do our chart, and then we get to do, all this other documentation, for the state level and the feds, because it was a, COVID related call and blah, 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 blah. It just sucked.
Then you get to do it all over again.
And then
over and over.
A couple hours later, we're doing it again. Yeah. It sucks. And there's really no other way to put it.
No, it really sucks.
Yeah.
It is, I don't know. It's just ripping. I don't know. I know there's a divide in the department, with the vaccine and with the calls and with the masks in the station and the masks in the rig and everything. Let's just all just do what we're supposed to do for a few more months and be done with this shit.
No kidding. Let's just do it. Let's gut it out,
Yeah.
And one of the things that I think is probably the most consistent challenge, as a company officer is, and it's really anyone that's going to work right now in EMS or fire, or in nursing, or wherever the heck you work in healthcare, is getting the people around you to kind of rally every day. And
right.
Hey, we got to do it again. I know this sucks, man, but we got to do it again. Yep, I heard you. If you want to get something off your chest, let's chat. But we still got to do it. And
still got to do it.
I really struggle when I'm having the same conversation with the same people. And I just feel like I'm not getting through. I don't have the thing that they need to hear, at the front of my brain. And it's a challenge, man.
I know. It's like that classic example of compassion fatigue.
Yes. Where
you do this day in and day out, and suddenly you're in this state where you just don't, like Dan was saying, you just don't care anymore. Mm-hmm. And compassion fatigue is dangerous because it doesn't get better unless you make it better. Mm-hmm. It leads to burnout. And that's, I think, what a lot of healthcare workers right now are feeling, is just that burnout, where you're just ready to check out and you're done.
Yeah.
And this is going to be a very lasting mark on our industry, mental health wise. And then you bring it home. You give all you have at work, and you've got nothing else to give at home, or the vice versa. You've got a lot of stuff going on at home. You've got nothing left to give your patients. And on the flip side of that, even in our personal lives, COVID is prevalent, right? Do I go to that Christmas party? Do I see my parents at Christmas? Do I, should I don't know. Like, every single decision you make is based on keeping everyone safe. It's just a lot to handle.
Mm-hmm. Yeah. Absolutely. And that's the hard thing. Is I have older kids, and I can't manage what they do. I have one who works, works as an EMT, and hopefully he's doing what he's supposed to be doing, and I remind him every single day. Mm-hmm. I have another one who's teaching from home, and so she's pretty dialed in on just staying here. And then I have another one who's my COVID police. He won't let us go anywhere without our mask, and which is great. Sometimes you need that reminder.
Yeah.
And Steve, I mean, I'm not a company officer, and I don't envy the position you're in right now. But I'll give an example. Like, I have not worn my uniform in 9 months.
Yeah.
And yesterday I had on some yoga pants. They call them yoga pants. They're actually sweat. And my chief called me out, my battalion chief, and he says, even though you're never going outside the station without high-vet suit on, you still have to look good and follow the rules in the station. Mm-hmm. You know what? You're absolutely right, sir. And I went in and I put on my shorts. I didn't put on my uniform, but at least they were fire department shorts, right? Right. So
you got to get some fire department yoga pants.
Yeah, we're working on it.
Yeah,
we're working on it.
Put that badge on them.
That's right.
Put a little radio clip on them. You're good to go.
Yeah, Dan, you would rock those.
Thank you.
Yeah, I think that the thing that I've had to loosen up on is kind of like what your battalion chief was doing. I get smacked down if a BC shows up to our station and sees X, Y, or Z. Now, I'll be honest, the last couple of years I've been downtown where all our managers are, where all of the white shirts reside. And so I don't really have to do a lot of hand holding because there's so many of them around that it's just expected that if you're working down here, have all your stuff on, make sure that you're, following all the rules, kind of a thing. Now,
what do you guys wear on your calls? Is it the same across the state? I'm sure it's department by department.
Yeah. So if
for us, it's crew by crew.
Yeah. I mean,
crew by crew?
Yeah, because we have different Tyvek suits, we have reusables, we have disposables, we have different types of N95. Some of us have P100, some of us have the whole SCBA mask with a P100 on it. So it's a minimum of an N95 and a Tyvek suit.
Yeah.
And glasses. So
for us,
but it didn't used to be that.
No, I mean, in the initial stages, it was, put a mask on calls. And we're like, oh, okay, like what the heck's going on? And then it slowly ramps up. And then I would say probably June, maybe July, they said, you know what? Any call that has priority symptoms, so our dispatchers, they're asking all the questions about COVID-related symptoms so that we at least kind of have an idea what we're going into, if it's a possibility, which I'll be honest, even then we've had a few show up. They're like, no, I have it. You're like, oh, okay, that wasn't on the CAD, so what the heck happened there? So for us on our crew, and like Dan said, it is kind of crew dependent. If we're going on an EMS call, we have an N95 and goggles on. And then if it's a priority symptoms call from the get-go, we'll wear a gown and, go in with everything on. But what's interesting is our department, I wish I could show photos through a podcast because I was shown a photo of our EMS chief when he accidentally stumbled onto 5,000 N95 masks that we didn't know we had. So, we had actually, we're inventorying how much we had because we had to start rationing it, right? And this was kind of early on, probably back in like April. And due to budget cuts a couple years prior, we had closed the station, which was a big ordeal. And I say a couple of years back, it was actually probably like a decade ago. But the county and the city still have access to that building, and so randomly they decided to go look in some of the storage areas at that station to see if they were, what was out there. And due to, changes in management and changes at the upper levels, they kind of forgot that they used that for PPE storage for a while. And so, when they moved where the PPE is stored to where we, find it today, which is downtown, they kind of forgot about all that stuff that was out there, which now with all this going on, it seems more egregious than it probably was 10 years ago. But yeah, so they go out there and, one of the other chiefs snaps a photo of the EMS chief seeing it for the first time, and he looks like a little kid at Christmas. It's so awesome. And, it was a really, really funny photo.
That is awesome.
Yeah.
I find myself with the PPE, my parents grew up during the Depression, and when my dad died, he died with, 7 jars of peanut butter in the back of his car because he was always hungry, when he was a kid. And I find myself doing that same type thing with PPE. I will hoard it. And when I find it, at another station, if I work a call shift and something better than we have, I might bring it over to the station, and, if they have a lot, I'll just spread it around around a little bit. Mm-hmm. But I am a hoarder. I will not throw away an N95 mask unless it's blatantly done.
There's only one size that fits me, or one particular one that fits me. And so I definitely hoard that particular one, because you show up to work and there's an N95, but if it doesn't fit you, what's the point in wearing it?
Exactly.
Right.
So I definitely hoarded as many as I could of our fond white masks we used to have.
Yeah.
Yes, I love those.
And for a little while, what was probably one of the hardest things to wrap my brain around, when all this kind of first started rolling out was, so nurses were coming out to our ambulances and asking if they could get an N95 from us at the hospital.
Mm-hmm.
And it was like, are you kidding me? First off, absolutely. Here's a mask. Like, this is so dumb.
Horrible.
That you don't have one. What is going on here? And it's just lack of preparation. All of, I still can't wrap my brain around that. If you run a hospital system, how is preparation for an outbreak not something that you practice routinely and prepare for by stocking up on supplies? Like,
it's all about money, man. You got to have enough supplies on hand for like 2 weeks.
Yeah, it should be like
especially the
months.
size of the hospital system you work with. I mean, there should have been a trailer full.
Yeah.
Yeah, but that's how they keep costs down, is to not stockpile things to expire. They literally, and I can't remember now when all of this started. Actually, it was back when the eclipse was happening.
Yeah.
We met with a bunch of the different hospital administrators to, make sure if we needed to shuttle supplies back and forth and all this. But literally, it's about 2 weeks of supplies on hand is how hospitals operate. And I could be wrong. It could be 4 weeks. But what I'm trying to say is it's kind of a skeleton amount of supplies because you just reorder them, right? You order them daily or weekly, and you don't never have an issue until everybody wants that PPE, and you can't get it, and now you're screwed.
Yeah.
I'm glad you shared. That was nice of you.
Oh, I mean, everybody cared because, Holly, you used to work at the system that we dropped patients off to or still drop patients off to all the time. Like, we're tight with the nurses there. Like,
very tight.
We really enjoy the staff at the ER, and, we have a lot of, pre-COVID, a lot of social stuff with, the nursing group and docs there. And, it was very common to hear about our guys, going to a party, a get together with, that was being hosted by someone at the hospital. And yeah, it was just, it still bugs me that was a reality that they had to work with, because we have them in the back of an ambulance, which is a confined space or an enclosed space for, 5 minutes to an hour. You guys are literally walking around in a room all day long, with that stuff. And, I mean, not only were we wearing them, but rightfully so in the beginning, we were giving all of our patients one. And so to have a nurse come out and say, "Hey, can I have one of those?" It's like, dude.
Oh my gosh.
Do you imagine what her face would have looked like when she saw that closet?
Yeah. Oh man.
Well, if you remember in the beginning, it was, the general public should not be wearing masks because the whole point of that statement was to preserve the ones we had for healthcare workers. And it wasn't till the summer when then it was, okay, everyone needs to be wearing a mask. It's like now we have enough we know a little bit more about it, everyone needs to mask up. And, yeah, it was interesting.
Yeah.
I would get angry at people for wearing N95s at the grocery store because I was thinking,
yep.
I've been using the same one for months, and you got one? Like, where'd you find it?
Mm-hmm. Yeah.
Boy, that is so true, isn't it?
Yeah.
What is did any of the people at your hospital system get vaccinated this last week?
Are you asking me or are you asking Holly? Or are you asking both of us?
Steve.
I just read a news article today that they have started, yes, with the Pfizer vaccine. And we were notified, earlier this week that the plan is, assuming everything, goes without any hiccups, is that our department would be given the Moderna vaccine by the end of the year.
Seriously?
Yeah, assuming obviously it gets emergency use authorization, assuming it gets sent out here with no problems. But
which is interesting. What you mentioned, that emergency use authorization, and I've been listening to a lot of stuff about the vaccine because people call me and think that, what are you going to do, Holly? I was like, I don't know. So I'm reading a lot and listening to a lot of interviews, and that emergency use provision doesn't mean that this vaccine has gone through any different process than any other vaccine that's ever been made here.
Correct.
Same amount of clinical trials, same amount of patients, same amount of time, same amount of rigorous testing. It's just that, well, first of all, funding is there.
Yep.
And it has gotten pushed through the red tape. And I think the other thing that makes it emergency use is that there's not that 2-year symptoms, that they normally can do with vaccines. But remember, H1N1 was the same type of emergency provision. So anyway, I just thought that was really interesting that we're using that word because remember when the hydroxychloroquine came out and that was under one of those emergency provisions. And medications are not held to the same standards as vaccines at all.
Right.
So you can actually use a medication that hasn't been tested for something under an emergency use, but not a vaccine. Vaccines are completely different, which really bolstered my confidence in the fact that, yes, I'm going to get this vaccine, and I can't wait.
Yeah, no, I'm very stoked to get it. And while I have some people that I work with, go ahead.
What is the consensus down there?
I would say it's probably 50-50 on who's going to get it and who's not. Yeah.
I don't know. We just did some type of a survey yesterday. I bet you it's going to be. I'll bet you it'll be a little less than that. I bet we'll have fewer people than that'll do it. I don't know why.
Honestly, man, I think it's politically motivated.
It is.
When you listen to, and I've had the conversations with multiple folks. When you listen to their concerns, they're literally spouting what's being shared on politically charged news resources that are not sharing information. It's more of just someone kind of throwing something out there as, well, what about this argument? And it's like, that has no medical basis or validity at all. But yet you just shared that on a politically bent news show. And now the people that follow this religiously are going to be spouting that as if it's accurate. And and
a lot of that's all of this information is available. If you are concerned that maybe they didn't test enough people or this vaccine got pushed through because, I don't know, for whatever reason, read.
Yeah, get educated.
Interviews, get educated on your own. And then, I mean, you're probably going to find that, people don't want the flu vaccine either. I get it. It's their choice. But, I'm not worried at all that this vaccine took shortcuts. Is what I'm saying.
No, me either.
Right.
Me either.
The first time the entire world is working on one thing, and it's actually a year isn't it's pretty fast for a vaccine, but I'm pretty sure H1N1. I think we had a vaccine within 8 or 9 months. Of course, that was a flu, and we're used to that. Done that before, but I don't know. I'm pretty confident so far.
I've been watching a handful of things that interviews with Dr. Offit, Paul Offit, the guy who helped lead the charge on the rotavirus vaccine. And he is so just easy to listen to, very down to earth. very straightforward. Doesn't, he just seems very personable, kind of just a nice dude overall. And I really enjoy listening to him talk to the people that are interviewing him, because he's just having a conversation and laying it all out there and saying, this is the information that is available. I'm not spinning it anyway. Mm-hmm. This is, the information that we have right now about this vaccine is as good as we could have hoped for ever. And he's fielded questions like, did they rush this? And he says, well, one of the reasons we got through it so quick is like what Holly was saying. One of the things that basically elongates the timeline for getting a vaccine into patients is the number of people who are willing to sign up and actually be a part of a phase 1 or phase 2 or phase 3 trial. And that's even funding aside. Like, people sometimes just won't sign up because they don't want to mess with this stuff. They don't have a reason to. But personally,
we all have a reason to.
Yeah, we've all got a lot of reasons to, right? And so it's really difficult when to get a vaccine approved when you can't get through the trials because you don't have people signing up. And so that's why it can take 2, 5, 10 years or longer to get something done, because unless people are heavily motivated, to be paid to be a part of these trials, they don't have a reason to. But that's not the case with these. So it's pretty awesome that humanity in general has really helped push this forward on top of obviously all the work that science is doing. So
and the technology is there. Like, we're smart people.
Yep.
And mRNA is not completely new. This is not a new concept either.
Right.
Everyone's like, well, we've never done this before, but we did. I mean, it's been around for a decade at least. H1N1 is an animal virus. And so it's definitely been looked at and studied for a really long time. And, just got to dig in a little bit and read some stuff.
Yeah. Yep. I think that's a good way of looking at it. Just read.
Do you guys think enough people are going to get it to at least start the herd immunity?
I do. I do. I think there's a lot of big talkers right now that are saying no, but when it actually rolls out and it's their opportunity, I think they're absolutely going to do it.
Yeah. I've been seeing a lot of social media posts of doctors and nurses, sort of like proudly getting their vaccine.
Yeah.
And I love that, because I do think that proves that our medical community is trustworthy of this, and they're in the know, and they see these patients every single day, and it's, I don't know, kind of gives me goosebumps every time I see one.
It was amazing to watch that the first day. I mean, it was historic, right? Something that hopefully we never have to see again in our lifetime.
Yeah.
But it was amazing to see.
Yeah.
So how about...
It brings a little bit of hope anyway, I think, maybe to the three of us. Does that help you guys when you're out there dealing with these patients, that maybe there is an end in sight? Because for a long time, we just, day in and day out, there's no end in sight.
Yeah, it absolutely has helped me. I feel much better about going to work. I feel that there eventually will be a safeguard. I just hope I don't let my guard down.
Yeah.
Thinking, oh, well, the virus, or even when I get the vaccine, like, oh, I got the vaccine, I don't have to do this, but I only have 18 more months left, and I don't ever see myself not having a mask on a call again.
Yeah, I know. It's become normal, huh?
Right. And so that's, like when I started in this profession and they just started wearing gloves because of the HIV/AIDS epidemic, that was a new thing for them, and it stuck. So we'll just see how this is in 10 years, 15 years. How many of you guys are still wearing masks?
Yeah.
I'll be long gone by then.
I have a question for you guys.
Yeah.
Just anecdotally and just observational only. It seems like the flu is less this year so far, and pediatric illness has been way down too. And again, I don't have any statistics. It's just anecdotally. Kids aren't in school. Everyone's wearing masks, hopefully washing their hands.
Much cleaner.
And we're kind of staying away from each other. Have you guys seen that too?
Absolutely.
Yeah, I think so.
It has been an amazing on that. Usually we're running on kids with, RSV and all this, flus and all that kind of stuff. And I haven't had anything so far this year.
Yeah.
Yeah. I mean, we're already running out of beds usually with the flu by now. So.
Right.
Okay. How about you in your area, Steve?
I think so. We haven't had any critical kid calls, knock on wood, medically, except until last shift. it was COVID related. We had an under 10-year-old with MISC, the multi-inflammatory syndrome that's caused by the COVID virus. And the thing that really kind of made me question some things about that call was just the severity of how sick this kid was, and the onset of symptoms didn't start until three or 4 weeks after the last positive test in this kid's house. And so it passed around to all the family members, but he didn't really start getting sick for a few weeks after. And
are they testing the kids too when they go in, or is that kind of the last in your area?
When you mean like when a
like
parent
his
tests
family had
positive?
COVID. Yeah.
I think it's both. That, it's an assumed case if you start developing symptoms, a presumptive case, I should say, and then it doesn't really change anything in terms of treatment more often than not, and so it's stay at home, isolate. You can basically come out of quarantine 10 days after your symptoms, or 7 days after your symptoms if you have a test that shows you're negative. So that's kind of what everybody's sticking to. But for the most part, I don't think a lot of kids are getting tested.
I know. I was wondering because, that also skews statistics too. People are like, kids aren't getting sick. They're not getting COVID, but we're just really not testing them either. Right.
And we have some schools that are open, private schools that are open down here. And they're doing the open for 2 weeks, closed for 2 weeks, open for 2 weeks, closed for 2 weeks. And at the end of the day, I don't know that that's any better for kids, having to deal with that constant, oh man, like going back into quarantine, versus just staying home and making it work with a small pod of people. But
at least it gets them out, gets them some social time.
Right. It's just a crapshoot, but at the same time, like with how rare it is in kids, these severe symptoms, which is, man, talk about a godsend. I'm so glad that we are not dealing with something that is crippling kids all over the place. Cause
I know. I think, gosh, whatever universe planned this out, like they at least spared us that.
That would be
that
horrible.
All the time,
Absolutely.
So how about personally? How are you guys doing? I know at my house, it's pretty good, because there's a lot more family time. My wife and I are closer.
Good.
We have more money because we're not going anywhere.
Right.
We get on each other's nerves, but overall, personally, it's been okay. Better than expected.
Yeah.
That's great to have that dynamic where work is so stressful. It's so nice that home isn't right now.
Right.
Yeah. We're doing pretty good. We've had a lot of just random stuff personally that's happened, lately, but, in terms of like COVID personally stuff, we actually lost my, grandma in North Carolina to COVID back in October. She was in a nursing home. They had an outbreak, and I think 20 or 25 people ended up getting it. And, she passed away on, I think she was day 12, post-diagnosis. And so, that sucked. She's in her mid 90s, so she didn't really have a chance, unfortunately.
Yeah.
But still,
it sucks. But when I think it sucks more because she wasn't, before the diagnosis, she was with it, she was there mentally. She had, she was still, getting around and doing her thing. But, the thing that I think, again, caught me off guard was how quickly it happened. Cause, obviously you hear a loved one has COVID, you're going to check in on them every single day, right? Well, getting updates from my dad, checking in with them occasionally, and, didn't hear anything. Everything's fine, no real symptoms. And then day 11, she actually has kind of a cough and she's not really feeling too good. And I'm like, oh, okay, well, they'll keep an eye on her and everything. And then that night it was, her cough's gotten really bad. They're kind of really checking up on her. And then the next day it was, we think she might have pneumonia or something. We were kind of getting some weird reports from the facility, and she's complaining about being a little short of breath. And then that progressed throughout the day to, she's really not doing good. We got to send her to the ER. And then as they were, basically getting ready to intubate her, she coded, and she has a DNR, so they didn't work her. But yeah, I mean, it was quick.
It's interesting that on day 11, she, and here we're saying if you're not symptomatic for 7 days or 10 days or whatever, go back to work. And that's too bad. I'm so sorry.
Yeah, that's horrible.
Steve, do you feel like, I sort of feel like a lot of people, especially out where I live, we live in a smaller community, west of the city. And like, I don't think it feels real out here because no one's been personally touched by it, as in my friend circle. Do you feel different now that your family's been touched by it? Does it feel more
absolutely
big or scary?
Yeah. What bothers me the most is when people are poo-pooing it in front of me, right? And you're kind of always fighting this urge to just lose it on them.
Or to be like, well, they were in their 90s.
Right, they're old.
Right, and that's kind of the thing,
like
right?
That's an okay reason to die,
were they elderly? Oh, did they have underlying conditions? And it's like, look, it's...
Oh, then it's okay.
Yeah, then it's fine. And
then it's not going to happen to me.
Right. And I think the thing that, the other part of this is, my family is spread out all across the country, and my house, again, knock on wood, is the only one that hasn't gotten it. My parents got it, and they live in just outside Tahoe, and they got their butts kicked by it, especially my mom. And luckily, they're doing good now. But it was just shy of a month of symptoms for my mom. She still has a very light cough from it.
Wow.
Yeah. But she did test negative, which is good. So. And then let's see, the family that I have in North Carolina that, my grandma, side of things, they all got it. There's like 12 or 15 of them, out there that got all distant cousins, and, my grandpa out there got it as well. And then, it's, I feel like people tend to get a lot more awareness and strict on it when it hits someone close to home. And
then it's a real
thing. And if you've never, and I know you both have because you're in healthcare, if you've never had to wait by the phone for your test results to see if you can go back to work or to see if you've tested positive because you were exposed, like it's nerve-wracking because your mind starts going to all the worst case scenario spots, and it becomes a lot more real in those moments.
Oh, absolutely.
But
and I know one of the places I work at right now, one of the protocols is that they really don't want to test you until 5 to 7 days after your exposure.
Yep.
Otherwise you have a higher chance of a false negative. And so sometimes when you do get that negative back, are you like, okay,
is it really negative?
Yeah.
Really negative, which is why you should comply with the rules of self-isolation and all of that stuff. But it's really scary. And it's really scary probably for your family and your extended family, knowing that you guys, and my family too, work on the front lines. And that's just another added stress to the family dynamic and the daily life of really putting yourself out there.
Yeah. And, Dan and I talked about that in April when we did I think it was like our second episode ever was on this COVID thing that keeps coming up. And, we were, I think we had just gotten out of quarantine, Dan, I know we didn't break the rules when we recorded. So it was either just before or just after. I can't remember. And, when I listened back over to some of recording, we were talking about, oh man, across the country, there's like 40,000 cases of this thing now.
Oh my God.
Yeah.
Yes.
And, I think we actually have a few positive cases in our state. And now it's, good Lord. Stand by. I'm going to give you the most accurate number.
Now over 3,000 people are dying. Yeah, go ahead.
Mm-hmm.
I love that.
Yeah. According to the Google, let's see, the last few days, 200,000 plus cases a day. And it looks like
200,000 a day.
Yeah.
In our state?
No, that's new cases in the U.S.
A day.
I'm sorry. I thought you said in our state. I'm like, wow, we don't really have that many people in our state.
No.
Right.
Yeah.
Pretty small.
We're pretty lucky in Oregon. We don't get, we haven't gotten the
which I think has
surges.
really helped us. Our population density isn't really there.
Mm-hmm. Yeah. Oregon has had in total, under 100,000 cases. We're at right around 99,000 and 1,200 deaths total. So,
oh man.
Yeah.
Steve, what are the statistics today of how many people a day are dying in the United States? I know we've surpassed our the total number of people who died in 9/11, right? Are we daily seeing about 3,000?
Yeah. Yesterday was 3,293. December 16th, I think, was the highest date on record yet, and that was 3,611. So hopefully we don't climb any higher than that. Yeah.
Well, we're talking about compassion fatigue, right? And getting annoyed by this thing and, not wanting to, just wanting to get in and out. And I think our country's seeing the same thing. Like, it's worse now than it ever has been. Mm-hmm. And less people are complying with the directives than ever.
Yeah, I love when people say that these rules that are being temporarily imposed are violating constitutional rights, and it's like, no, they're not. They're absolutely not. They're
not one bit.
They are for your safety, and they are for the health of our country. Like, they are something to be celebrated because we want to take care of one another. But the one call I wanted to kind of, it's touching on the stuff that you guys have brought up, especially compassion fatigue and just feeling like I can't do as much as I'd like to. We had a gentleman in our county, basically call comes in at, early in the morning, and we had just had a rash of calls that have come in. And so, we're heading down to like the south end of our county kind of a thing. And, very, as far as, we would go in our district kind of thing. And, we're going to be the first ones on scene because all the ambulances are out, and we're heading down there and starting to kind of read the CAD notes, like, this sounds like it could be, we're going on a cardiac arrest. We knew that. But, they weren't giving us any obvious COVID, signs. And so regardless, any cardiac arrest right now, we have all the stuff on, right?
Right.
So we hop out, get our gear. We've got everything, all the PPE on. We go into this house, and the lady is just screaming at us, like, he had COVID. And then she's like, I have COVID. And, the gentleman was in his 80s and had some underlying conditions. And the detail that just gets me every single time I think about that call is when we found him, he was reaching for his inhaler. And just, gone. And, he had a history of, COPD. And so we're trying to get the story from the wife, and she's telling us, basically the last time he was seen alive was before they went to bed. And so here we are a few hours later. It's like, all right, well, we're not going to work this one, and find him an asystole, and we're done. But one of the things that I take pride in, and I think I've kind of moved towards this in the last couple years, especially with going through the PTSD stuff and, really starting to change my focus on just being a good clinician to like really doing all the extras really, really well, or trying to and be cognizant of them. is I wanted to focus on her and make her the patient, right? And make sure that she was doing okay and check on her and take good care of her and do all these things. But like, we've got these protocols, and you got to, get in, get out. And my ability to just hang out with her on scene wasn't an option. And so instead, we're opening up doors and windows, ventilating the space, right? And, trying to because we're basically helping, Deputy ME has to come in, right, and do their investigation, but they've got their own protocols. And so did a couple things to help them out before they started, but then we took off. And that extra level, that extra yard that we want to go for family and ultimately our patients, can't really do it. And so. No,
and that's hard on both sides too. All these people are dying on FaceTime. Yeah. Families can't be with them. They're isolated at the end of their life. Healthcare providers don't want to see that, and family members don't want to see that, and patients certainly don't want to be, if they're awake, in that scary position. And it's just awful all around.
Yeah, I know that one of my close friends, his wife is a nurse in the ICU up here, and there's times where she comes home and she can't really talk. She's just so distraught and so beat up by what she's seen. And she's basically on a fairly regular basis having to hold a family FaceTime phone call in her hand while her, the loved one expires. And she's listening to these family members saying prayers or, saying what they loved about the person or telling them that they loved them and why. And, just these gut-wrenching end-of-life, interactions. And, then, the loved one expires, right? And then she stays on the phone, while they all lose it and then share with each other how much, they're grateful for the nurse and, which is nice, but like, they don't want to have to do that. I mean,
no,
that's just,
we do have certain things that there are certain boundaries that we approach as healthcare providers, which is be very caring and loving and compassionate, but you have to keep that distance in the moment in order to continue your day. And that makes it very difficult.
Yeah. I just totally feel for all you guys, Holly.
Emotionally exhausting.
Yeah. I feel pretty good at my ability to tell someone their loved one has died and then do the steps and then I'm out of there. But sitting in that grief is not something that I do, and that's what nurses do every damn day. And
then being with that patient day after day,
right?
And with their
developing
family
that relationship.
You do. You get
that would
attached.
be really hard.
Yikes!
Not imagine.
Holly, I don't know if we talked to you about. Do they have plans for rolling out vaccines where you're working?
I don't know yet.
Don't know. Yeah.
We'll see.
So I think information is kind of still forthcoming, but.
Yep. I know my sister works up in Washington and they're getting theirs by the end of December.
Nice.
And I know some of the bigger hospitals around here have started vaccinating last week. So.
Yeah. Good.
We'll see how it goes.
You know what I want to see as, we've been looking at freaking graphs all year long, right? And it's this steep up and to the right kind of swings on these things and these steep climbs with these numbers. I want to see vaccine numbers on the same scale. Like, I want to chart every single day.
To see who gets it?
Yeah, I want to see what the numbers are. How many people have been given a vaccine? Like, let's start charting that because
give us some hope.
Yeah, give us a little bit of hope, and let's talk about something good that's coming with the bad kind of a thing too. So,
Yeah.
Ugh.
What is one thing you're grateful for during this pandemic?
Dan, you're going to get that one first because I got to think about my answer.
I think Dan already kind of said his, but go ahead.
What was mine? Oh,
yeah, what was his?
Well, you were saying some good things that happened, so tell us what you're grateful for.
Are you talking to me again?
Yeah, that's for you,
I
Daniel.
wish I could see you looking right at me.
Daniel, you go first.
Okay. Well, I talked about the time I've been able to spend with my family, some of the lone trips to a place we have in the mountains. And then, I'm real grateful to work for a fire department that has really gone above and beyond on making sure this does not hit our department. Knock on wood, we've only had 7 people out of 600, and that's pretty good for as many calls as we've done. Yeah, so we've been real fortunate, and I'm just grateful to still have a job.
Mm-hmm. Yeah, man.
Steve, now's your turn, buddy.
Yeah, kind of the same lines. Grateful to have a job. I've have friends and family who've lost theirs or been significantly impacted, and I'm not going through this and worrying about whether or not we can buy groceries this week.
Exactly.
Right.
And so very, very grateful for that. I also feel like COVID has caused a forced slowdown. And so early on, I feel like I kind of resisted it, because I'm literally locked in a house with my family, and we're not going to all the things we would usually be doing that would take us away from one another throughout the day. And
which is great, right? Especially with young kids.
Yeah. And so now it's like, man, I've got my son home all the time. I've got my daughter home all the time. And we're really focused on just being really, what's the word I'm looking for? Deliberate in the time that we spend together throughout the day. So, they've got online school. They'll go do their online school thing. But we check in, then we do lunch together, which is fun. I mean, you never got to do that when they were in school. And then, we're usually crushing some show or a movie at night as a family. And, that's been really, really cool. So The Mandalorian is a big hit right now in our family.
Yeah, it's on tonight.
Yes, with the child and all the. I feel like I get to geek out on all the Star Wars stuff with my son especially, and then my daughter loves it because of the Baby Yoda child thing.
Baby Yoda,
and then my wife, who was never into Star Wars at all, is into this show because it's a really interesting storyline. So. I mean, that having that time has really made me something I'm grateful for as well. Your turn, Holly.
Yeah, that is one thing I will miss.
Yeah.
The only thing I'll miss.
Or not. Don't change it.
Yeah.
Yeah. But, we always slip back into our old habits, unfortunately.
How long does it take to make a new habit? Like 3 weeks or something like that? We're there.
Good point.
Yeah.
Good point.
Yeah.
One thing, I have a teenager, so of course she doesn't like to come and hang out with me all day long. But one thing one day we were driving around and my daughter goes, "Mom, you know what everybody says 2020 sucks?" And she goes, "I've actually had a pretty good summer." And
nice.
I was like, wow. I was really grateful for that conversation with her because it really reminded me to find some sort of joy in the chaos.
Mm-hmm.
And her joy was slowing down and not doing 3 dance classes and horseback riding and after school sports and all of these things. She got to have a summer where she rode horses all summer and sat in her room and did what
hung out with a friend. Yep.
Yeah. We had one friend that she gets to hang out with. And it really did make me mindful that even though things do suck, don't get wrapped up in everybody else's interpretation of what sucks. And if you can find some joy, it's okay. You don't have to feel guilty about that.
Right.
And actually, it's really good for our well-being. So
I was
really grateful for that sweet perception of my almost teenager back then. So.
Yeah, take what you can get.
Absolutely. And I know when Dr. Offit was asked in one of the interviews I watched, when are you going to feel like we're in the clear, or we're doing well as a world, as a country? And he said he's a season ticket holder for Eagles games, and he said when I can go to an Eagles game and not wear a mask, that's when I will feel like we're in the clear. He said because it's really hard to boo through a mask. So I was like, yeah, That will be. I'm looking forward to going to concerts again. Holy cow!
Oh my gosh, I miss live music so much.
Yeah. Oh man, but that's my big thing.
It's
what about you,
coming.
Dan? What are you going to look forward to the most when restrictions are eased?
Going back to the gym. Going out to eat with my family, without that mask on. I'm just so tired of thinking about it. Just constantly, every call. This is the one. This is where I touch my face the wrong way or something. That's what I'm looking forward to.
Yeah.
Inner peace.
Yep.
Oh. I'm looking forward to seeing my sister again. Because she works on a strict COVID unit, and she will not allow herself to see us because she doesn't want to expose us unnecessarily, especially my parents. Yeah. And I have not seen her for months, and I won't see her for Christmas. So I'm excited to see my sister again.
That will be good.
Crazy. And that, those are the sacrifices that the media just doesn't really talk about, that people don't really share, You're willing to say this is all just a joke, but there's people that haven't seen their loved ones in 9 months. Because they're doing that job. So tell your sister thank you. It's appreciated.
I will.
Very much.
Yeah.
I'll make her listen to the podcast. She likes our podcast.
Good. Good. Well, guys, let's close it there, and
all right,
we'll sign off and.